Hello guys, now we are going to see about the arsenic poisoning in forensic medicine. Okay, first in the objective we are going to see about the arsenic uses and source, the absorption and metabolism and excretion of the arsenic and the mechanism of action and clinical features, the acute poisoning and chronic poisoning and differential diagnosis and management and autopsy findings and lost medico-legal importance. In the arsenic, it is a metal, but it doesn't very toxic in metallic state. When it is in salt medium, it is very toxic. It's inorganic salt or organic salts. The uses of the arsenic is rodenticide, weed killer, and coloring agent in used in alloys. Okay, the most arsenic is used in rodenticide and weed killers. The source of arsenic is in rocks and soil, in drinking water and seawater and seafood, industrial source, and in lost it's in vegetable and fruits, in hot spring mineral water. In coming to the absorption and metabolism and excretion, it is absorbed via skin, inhalation and GIT mucosa, or it is absorbed through the damaged skin. In metabolism, it is metabolized by liver by methylation. It formed monoethyl arsenic acid into the dimethyl arsenic acid. It is excreted in urine. Coming to the mechanism of action, its arsenic is combined with sulfahydryl enzymes, so it blocks the Krux cycle and decreased ATP synthesis. It leads to death of the cell, and also it inhibits the acetyl CoA into succinyl CoA, and it replaces the phosphorus in the bones, and also it incorporated into hair and nail skins. Arsenic is increased vascular permeability, so it leads to inflammation and necrosis. In clinical features, it is acute and chronic. Coming to the first, in acute poisoning, you can feel the taste, the metallic taste and garlic odor and nausea and vomiting and colicky abdominal pain and refused diarrhea. It's resembling like rice stool water of cholera, and circulatory failure, uremia, oliguria and tachycardia, tremor and headache, vertigo, convulsions and formication. Formications means feeling of insect crawling sensation, and delirium and tenderness in muscle and paralysis, hyperpyrexia, increased fever and QT prolongation and tachyarrhythmia. Coming to the difference between arsenic acute poisoning and cholera. The feature, the pain in throat in arsenic is before vomiting, but in cholera it is the after vomiting you can feel the pain in throat. The conjunctiva is inflamed in arsenic poison because of increased permeability of blood vessels, but in cholera it's not inflamed. Coming to the vomitus, it contains mucus, bile and streaks of blood, but in cholera it is the only rice water stool, watery or V-like. In purging, it follows vomiting, usually precedes vomiting. Okay, the stools in arsenic poisoning rise watery in early stage, later it becomes bloody, discharged with straining and tenesmus, but in cholera it is rice water liquid, involuntary jet. In laboratory examination, radio opaque shadow on X-ray because of it is metal. in abdomen in arsenic trioxide poisoning, copropurpyrin in urine, and arsenic is detected in chemical analysis. But in laboratory examination in cholera, we can only see Vibrio cholerae detected on microscopic examination. Okay, in coming to the chronic poison of arsenic. First, loss of appetite, salivation, constipation, colic abdominal pain, vomiting, and red and soft gums is present, and periorbital edema, ankle of edema, and voice is husky and hoarse, and rhinorrhea. And in chronic poison only you can see the raindrop pigmentation. You can see some pigmentation over the chest. It is generalized or localized fine mottled pigmentation of the skin. You can see in chronic poisoning epithelial hyperplasia with keratosis, mostly seen on sole and palms. See sole and palms, epithelial hyperplasia with keratosis. Nails become brittle and show meese line. Meese lines are white transverse line over the nails. You can see here also. It is otherwise called Aldrich meese line. It is seen in chronic poison. See, in chronic poison only you can see the raindrop pigmentation and epithelial hyperplasia with keratosis and Aldrich meese line. These three things are most important. And in chronic poisoning, you can see the nasal septum perforation, alopecia, liver enlarged, melanosis of neck and nipples, headache and a tingling sensation, numbness of extremities, and hyperesthesia of the skin. Hyperesthesia means increased sensitivity. And you can felt muscle cramps, knee jerk is lost, arthralgia seen, and impotence, aplastic anemia, bone marrow depression, and peripheral neuropathy, ataxia seen, emaciation. Emaciation means loss of appetite leads to it look like dull body. And tremor seen, anemia, encephalopathy, delusion, and death. Anemia is most important and jaundice also important in chronic poisoning. The neuropathy is hallmark of organic poisoning. Sorry, organic, not organic. It's arsenic poison. It's resembling like Guillain-Barré syndrome. The weakness of muscle and atrophy is seen. So you can see the wrist drop and foot drop. Hematological abnormalities in arsenic poison. It's most important. First, leukoplakia and thrombocytopenia, eosinophilia and megaloblastic anemia, and finally basophilic stifling. Hematological abnormalities in arsenic poison. So this is the main important viva question. Leukoplakia, thrombocytopenia, eosinophilia and megaloblastic anemia, basophilic stifling seen. And coming to the differential diagnosis. The acute poison is resemble like cholera. The chronic poison is resemble like alcoholic neuritis and Guillain-Barré syndrome. In management, the management of arsenic poison is important. First, gastric cleavage and maintain the fluid replacement and correct the electrolyte imbalance. And if there is any bleeding, you have to do blood transfusion if need. And chelation, it is most important in arsenic poisoning. First, we used British anti-lewisite. And second, dimethyl mercaptosuccinic acid and dimercaptopropanthosulfonate. The mostly we used British anti-lewisite. The fatal dose is the arsenic oxide is 180 mg. The fatal period is 12 to 48 hours. And coming to the autopsy findings. First, the rigor mortis lost for longer duration. Second, jaundice. Third, congested and edematous GIT mucosa and hemorrhagic gastroenteritis seen, and fatty degeneration of the liver and subendocardial hemorrhage in heart. The focal hemorrhages given rise to flea pattern appearance, and the preserved for chemical analysis is routine viscera, long bone femur, and hair, muscle, nail, and skin. Coming to the main thing is medico-legal importance. First, it is the homicidal poison, ideal homicidal poisoning, and second is cattle poison, and third is accidental poisoning. In accidental poisoning, if they drink well water or adulteration with alcohol drink or mistaken for medicine. And last is orphanophagist. Some people take arsenic daily as an abrosidic or habituate. That means they are take arsenic daily for their sexual enhancement feelings. Okay, and